in progress.
Hello, good evening, everyone, and thank you for joining us for Should I Choose a Doctor or Midwife? Doctor, Midwife, which one is right for you? My name is Kayla Thomas, and I'm with Nebraska Medicine, and I'm just here to go over some housekeeping details before I turn things over to our experts today. First of all, just a reminder, this is a general discussion. It's for informational purposes only. So if you have any questions specific to your own health or medical condition, you want to take those towards your primary care provider. We are, of course, however, welcoming general questions. If you do have some, you don't need to wait till the end of the presentation to ask those. You can use the Q&A button on the bottom of your screen to go ahead and submit questions, and you can even do that anonymously if you're more comfortable. If you want to reach a member of our team, or if you're having any technical questions or anything like that, you can use the chat function for that. So I will mention this webinar is being recorded. I'm sure you got that disclosure there. Your name and your information will not be shared. Just wanted to let you know that. Thank you very much. Our presentation today is from Heather Ramsey and Alyssa Lawler from our midwife team. They have got some great information. So I'm going to go ahead and go quiet and keep an eye on those questions and let them take over. Heather, Alyssa, thank you so much for being here and for your time and your expertise.
Well, hi guys, my name is Heather, and Alyssa will follow here just shortly after me. I wanted to introduce myself. I'm a nurse midwife at Nebraska Medicine. I've been a midwife for several years, and the reason I became a midwife is because I had the most amazing, awesome labor and delivery nurse with my first child. She rubbed my back and braided my hair and put me in the tub. And I found what true compassion and true bedside nursing was. So that's why I ended up going to nursing school and became a midwife. Alyssa?
Hi, everyone. My name is Alyssa Lawler, and also Alyssa Fisher listed here. That's both me. And I started my journey as a nurse in labor and delivery. And then I fell in love with women and their families at the bedside. And the reason I became a midwife was because I wanted to extend that into the clinic and be a bigger part of those patients and their families' lives. And then, you know, I'm sure Heather can attest to this even more than I can, but it's really exciting now that I have patients that I'm seeing that I've delivered now their first and second baby. And that's really, really exciting for me. And then you get to watch people grow and their families grow. And, you know, I know that Heather and I were talking about earlier, we each kind of wanted to share one thing that, you know, we're really passionate about in midwifery. And for me, because I started at the bedside, you know, one of my biggest things that I am passionate about is just being at the bedside and watching women and making sure that we can have those undisturbed births.
Yeah, same with me. Alyssa and I were kind of on the same page. I am a strong proponent of physiologic birth and allowing women to birth normally under their own power, and seeing how that transforms them psychologically, emotionally, spiritually, and how the family is also transformed. So we present to you today deliberation between choosing between a midwife and a physician.
All right, so I'm going to kick us off here. Those two pink lines there, you're pregnant. So now what? And, you know, for a lot of women, you know, sometimes this is a planned pregnancy that happened really fast after you said you were going to start trying. For some women, they waited months to see this positive pregnancy test. And for some women, they've, you know, waited longer and they've sought care for pregnancy. Either way, congratulations, you're pregnant. Or for those of you who are not yet pregnant, congratulations in the future. So there's so many emotions that come along with this realization that you're going to start growing your family. And also a lot of questions that come along with that. So, things like, is it going to be a girl or a boy? Do I want to deliver in a hospital or a birth center? Do I want pain medication during my delivery? Do I want an unmedicated birth? And then also importantly, one of the topics that we're talking about today is, who do I want to care for me during my pregnancy and delivery? Of course, everybody wants somebody that they can trust, somebody that's reliable, and a skilled provider who can help you navigate the pregnancy and delivery, of course, with care and compassion. And so it's a very personal decision to make. And it's important that you know your options. So should you choose a doctor or midwife?
So what's the difference between a doctor and a midwife? First, let's talk about the similarities. Midwives and doctors are both highly trained and certified. Midwives and doctors are also both experts in women's healthcare and have extensive education and training in both of those aspects. They're committed to your safety and comfort, and are extremely passionate about what they do. They both work with you in order to honor your pregnancy goals and your birth plan, while also offering their expertise and information on your care options as your pregnancy progresses. Midwives and doctors strive to give you the best experience. That means they'll help you have the pregnancy care and childbirthing experience that you're hoping for, regardless of who you choose as your provider.
So we're going to break off a little bit and talk about doctors. So doctors and midwives, they do have different credentials and different educational backgrounds. Most doctors are medical doctors or doctors of osteopathy, as you can see listed here. An obstetrician gynecologist is a medical doctor who specializes in women's reproductive health, as well as pregnancy care and delivering babies. They're also surgically trained. They can perform C-sections or assisted birth, like forceps or vacuum-assisted delivery. And our OB-GYN doctors, they do complete 4 years of education and then in medical school, and then they go on to a 4-year residency. Family medicine doctors specialize in comprehensive healthcare for people of all ages. And so they can care for you during pregnancy, delivery, but then they also can take care of babies after they're born. Some family medicine doctors are specially trained in procedures like cesarean sections and assisted birth, like the forceps and vacuum. And they also complete 4 years of medical school in a 3-year residency program.
Just like OBGYNs, midwives can provide a broad range of healthcare services, such as annual checkups, family planning, and menopause care. But what they're most widely known for is pregnancy, birth, and postpartum care. They work closely with the rest of your healthcare team, such as your OBGYN doctor or your family medicine doctor, to meet the needs of you during your pregnancy. Most women who continue to use their midwives for care for their delivery also choose to see them afterwards for postpartum care and for annual exams. Certified nurse midwives are registered nurses who have a master's or doctoral degree. They're certified by the American Midwifery Certification Board and licensed in the state of Nebraska.
All right, so the greatest difference between doctors and midwives is that we have different birthing specialties. So in certified nurse midwives, we specialize in low risk pregnancy care and delivery. And OB-GYNs, they specialize in all the spectrum, so low, moderate, and some high risk pregnancies. And then our maternal fetal medicine doctors, sometimes are also known as our high risk OB doctors. And so, delivering, depending on your delivery preferences, some patients may risk out of midwifery care, like for women who are expecting twin twins or who have pre-existing high blood pressure or diabetes. And, importantly to note though, we do have a good working relationship. So nurse midwives work with OB-GYNs and high-risk OBs, and we collaborate our care appropriately. Some of that care is referred. So we, as midwives, sometimes refer patients to our OB-GYNs or maternal fetal medicine. And then there's a lot of occurrences where we work together to care for our patients in pregnancy and delivery.
So another one of the big differences between nurse midwives and doctors is that midwives typically practice as a low-tech, high-touch point of view. And so what does that mean? It doesn't mean that midwives don't use technology in the birth. It means is that we use technology based on the risk status of the mother. So for instance, continuous electronic fetal monitoring is not needed for every pregnancy, labor, and birth. And so we judiciously apply that technology to the women that need it and don't use it when it's not required. The other things that we do is we typically have less intervention as far as induction of labor, less use of epidurals. And another big difference is that midwives typically stay with the woman throughout her labor and delivery process. Midwives can offer any type of pain medication. So I often get women that ask me, gee, I don't know, I think I need to transfer to a doctor because I want an epidural. We can offer epidurals and we go over the risks and the benefits of any intervention prior to application to make sure that the woman is well aware of her rights and her choices in childbirth. Doctors, typically there's an increased incidence of labor inductions and epidurals. The nurses are the ones that typically are at the bedside of these women, and the doctors come in and manage the actual delivery process. And doctors also can offer any type of pain medication that is available out there.
So kind of, pulling through that last slide, the word midwife means with women. And so, really, I know Heather talked about this, she really hit on this, that midwives stay with you, especially in that active phase of labor. So when we talk about birthing options, it's so important for women and their families to, really sit down and think about what do we want for our pregnancy, what do we want for our delivery? And when we talk about birthing options, a lot of things that is, it's really important to talk to your providers about to make sure you're on the same page as, nurse midwives. We usually encourage food and fluids in labor. We know the importance of that. And we encourage mobility in labor. So walking, changing positions, and things like massage therapy, personal touch, aromatherapy, music therapy are all very, very important. And really making it a setting that's your own, that, that women are comfortable in. And hydrotherapy is something that we offer as a pain management in labor. And I know Heather talked about this, but not all women need continuous fetal monitoring. A lot of times, if a woman is low risk and has no high risk factors, we can do something called intermittent auscultation, which is listening for those for that baby's heart rate at the beginning, during, and after a contraction to monitor baby's heart rate. Delivery in any position. One of the things I like to talk about is, physicians are used to delivering, or OB-GYNs are used to delivering patients on their back. And so it's really interesting when they come in and they're assisting with a midwifery delivery and the patient is on their hands and knees or on their side. And I always tell women you can deliver in any position, but standing on your head. And so, patients appreciate that autonomy. And we encourage support of a doula who is a person that can be at the bedside at home with patients before birth starts and then at home postpartum. And then we really like to encourage the birth partner to be a part of that birth too, in any way possible, and helping them feel comfortable. Doctors' approaches to birthing options differ drastically. And so, it's really important to talk to your provider about your preferences, and having an honest conversation about that throughout your pregnancy is important.
So what are the differences when it comes to operative delivery? Operative delivery refers to forceps, vacuum, vaginal birth, as well as cesarean sections. Nurse midwives and most family practice doctors do not do forceps, vacuum, or cesarean deliveries. There are some family medicine doctors that do vacuum assisted deliveries and cesarean sections. So if you're wondering about that, please ask your family doctor if they do that. If you choose a provider that does not do vacuum or forceps or cesarean section deliveries, they all have close relationships with providers that do. So for instance, at Nebraska Medicine, all of the midwives work very closely and hand with our OBGYN partners who can assist with an operative delivery if needed. Now, OBGYN doctors and maternal fetal medicine doctors can deliver a baby in any way.
Okay, so how to choose. What should you consider when you're choosing between a doctor or a midwife for pregnancy care? So like we talked about at the very beginning, this is a really personal decision. Your goals, preferences, health and safety of not only you, but your unborn child should all be taken into account, and your family. And so here's some things to consider as you weigh your options. First thing is, are you considered high risk? So if your pregnancy is deemed high risk or complicated, you'll want to work with an OB-GYN provider who may also coordinate care with that high-risk maternal fetal medicine provider. And then if you're expecting twins, have diabetes or other pre-existing health conditions, your pregnancy may be considered higher risk. And then where do you want to deliver your baby? So if you're low risk, and considering a birth center, a midwife is likely at the top of your list of potential care providers. If you're planning a hospital birth, most doctors and midwives deliver at only 1 or 2 hospitals. So, when you're choosing that midwife or provider, you're likely choosing the hospital that you're going to be giving birth at. And then when you talk about how do you want to deliver your baby, if you're low risk and leaning towards hydrotherapy or hypnobirth, an experienced midwife is likely who you'll want to look into. Regardless of risk, though, if you think you'd be more comfortable with a medical doctor providing care, then an OB-GYN or family practice provider is likely going to be a good option for you. If you're wanting a wide range of birth and pain management options, so you have flexibility when the day arrives, you might want to find a doctor or a midwife who does deliver in a hospital. And that's really important. So insurance plan coverage, you want to look into that because many women wonder if there's a cost difference between midwives and physicians. And really the cost really primarily depends on where you deliver, what types of interventions you have, and what type of delivery you have. So not necessarily who delivers your baby. And it's really quite possible that your insurance doesn't cover the hospital or birth center that you pick initially. So it's important to look into that. And if you still undecided, you don't know, of course, a good provider patient relationship is necessary. And so you can always contact the clinic and schedule a meet and greet via telehealth or in person. And you really want to get a good feel for that office. And it starts by the time you walk in, from the time that you meet the front desk, how the workflow goes, and then meeting with those providers and really making sure that you're on the same page with your goals.
Well, that concludes our presentation. This phone number here is the generic phone number or our front desk. If you need to get a hold of either Alyssa or I, here's our personal work emails. You can reach out to us here. So we're happy to take questions if there are any.
Go ahead and use that Q&A function if you do want to submit any questions. If you are watching this after the fact, we will do our best to go ahead and get questions answered as well. That's why we've got that contact information out there. One of the things that I know our midwife team is very proud of is working with moms who are going for a VBAC. Can you talk a little bit kind of about the process there? And also what it means in case someone doesn't know, since I'm throwing around terminology like I'm an expert.
That's great, Kayla. Yeah, VBAC means vaginal birth after cesarean. And just because you've had one or sometimes two cesareans does not mean that you need another cesarean. And so we're fortunate to work in an institution where VBAC is supported and encouraged. Our VBAC success rate is very high. And our moms are quite motivated that come to us for a VBAC. So that helps as well.
And I think that that's also a true testament to how well we work with our providers, and you know, we have such a good working relationship that we trust one another, and our patients really do a great job, and they're very well taken care of.
One of the things that I have heard from our patients that use our midwife team is how much they love the team approach and getting to meet the different members. Can you explain how that works?
Yeah, so there are 6 of us midwives. We use the group approach to prenatal care. And so we like that our patients get to meet all of us in their pregnancy. And, you know, sometimes when people hear that, like, oh no, it's a little bit of a shock that I have to meet 6 providers, but we all practice the midwifery philosophy of care. So we all practice very similarly. And when you get a chance to meet every single person that you may see the day of birth, it's a little bit of a relief when you walk in and you've met that person. And so it's really important to us that we get to meet all of our patients, and all of our patients get to meet all of us. And patients really love that they have gotten to meet us when we walk in that door. And very rarely does it happen that I have not met a patient that I get to catch their baby, but it's always meant to be when that happens.
So my children are, I'm aging myself here, almost 10 and 13. And I feel like at the time when I had them, I didn't even know that this was an option. Can you talk a little bit about kind of, I guess, popularity is a weird word, but I guess the growth of this field and why so many more women are choosing this option?
Yeah, I can answer that. I've been a midwife a long time, so I'll date myself too. My youngest child was born by a midwife at Nebraska Medicine, and he is 21 years old this year. And so I've seen the practice of midwifery change in Nebraska over the last couple of decades. Back then in the late 90s, in Nebraska, nurse midwives only delivered about 2% of all the babies that were delivered in Nebraska. And at last count, we're at about 12%. So we're definitely increasing, although not in the majority.
So birth plans are things that can evolve and change. If you're working with someone throughout the course of their pregnancy who maybe winds up in a situation where they have to have an induction or something like that, how can you kind of help them accept changes in their plans and still help them have as close to the birth that they were imagining as they want?
That's a really good question. And, you know, one that we sometimes do have to have a conversation about. We do have patients who require a medically indicated induction, and they maybe necessarily did not want that to be the case. But there are ways that we can do an induction to make sure that patients still get to do a lot of the things on their birth preference or birth plan. And, oftentimes we can make sure that, we take that process very slowly, and we make sure that they are mobile and that they have good support at the bedside. And we just really emphasize education and not pushing anything too fast. I have a lot of patients who have had to be induced that at the end of it were very surprised pleasantly that it was not as scary or traumatic as they thought it was going to be, that it was in fact a really pleasant experience, and they got to do a lot of the things that they wanted. And sometimes the medically indicated inductions, we're able to do those things because we are being safe with the induction and the delivery. So they do get to do a lot of the things that they wanted initially.
Yeah, I have a personal story on that. I have a gal that came to see me. She had 3 prior deliveries, inductions and epidurals with all of them, and wanted a different experience and came to a midwife. She did end up requiring a medical induction. She was so upset about it, but we actually were able to get her delivered with the most minimal intervention. And she delivered on her hands and knees, and her husband caught her baby, and she was holding her baby skin to skin, and the tears were just falling from her cheeks. And she goes, I had no idea birth could be like this. So it was really inspiring, despite the need for a little bit of intervention.
I'll just ask this question before we wrap for both of you. Is that the best part of the job? Because this is a special calling. It's different than a lot of other specialties.
I was just gonna say, Heather, you just gave me goosebumps. Yeah, I mean, you get to be a part of something so beautiful, and it's not, I think the best part is you get to watch, like Heather said, the families, and it's important that they're involved because this is their experience, this is their life. They're bringing a new person into this world, and it's amazing. It really is.
Yeah, I agree. And if you look out there at midwives in general across the United States, most of them do not retire from clinical practice because this job is so rewarding, to be able to help inspire and empower others.
I think empowering is just that word, especially when you think of, like, we grow up watching the way that people give birth on TV and in movies. And it's such a different experience, having been through it twice myself, than what you see. And just knowing that you can provide the information and the education to have people really create the experience that they want to. Any final thoughts that you would like to provide before we wrap things up?
Just that please reach out to your providers. If you're currently seeing a physician and some of these things have spiked your interest, talk with your physician. There are so many physicians that practice very similar to midwives. Talk to your physician and see if they're agreeable to your type of ideas and birth plan. And change providers if you want to, but change early in your pregnancy.
I agree.
Thank you both for your time today. Again, contact information is available 402-559-4500 if you want to reach our midwife team. For those of you who are watching, you will receive a copy of this via email. So if you had any questions or you want to go back and watch anything else, or if you want to share this with a friend or relative or supportive birth partner, you can go ahead and do that as well. So thank you for your time and have a great evening, everyone. And Heather and Alyssa, thank you so much.
Thank you.
Thank you.